Thank you. Good morning, everyone. Welcome to House Labor and Health and Social Services Committee. Members of the committee, good morning. Welcome. Members of the public and those joining us via Zoom, welcome as well. Mr. Caldwell, if you would call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heft. Representative McCann. Representative Ottman.
Here.
Representative Stivar. Representative Wasserberger.
Here.
Representative Yen.
Here.
Chairman Rodriguez Williams. We have a quorum.
Thank you. Okay, so for those of you that are new to the committee, we do have a few rules that pertain to decorum. The full sheet's available outside of the room. I'll just go through a few for everybody's knowledge, and for those that are joining us online, they apply as well. Please keep your cell phones on silent. Although it might seem an awkward formality, speakers will address their comments and questions to the chair, not to individual committee members or to others in attendance. This helps us avoid personalities and comments of a personal nature. Comments will be directed to the issue under discussion by the committee. Distracting comments on unrelated side issues are out of order. Speakers will avoid personal criticism, ridicule, or name-calling directed at anyone else in attendance at the meeting. This includes comments of a personal nature directed at other speakers, audience members, or members of the committee. For audience members, we expect that you'll refrain from any behavior that disrupts the orderly conduct of the meeting. Specifically, the rules prohibit speaking out loud when another person is talking, carrying on loud and distracting side conversations, shouting, clapping, or booing in response to a speaker's comments. Our guidelines are simple. We just ask that everyone conducts themselves in a civil and respectful manner at all times during the meeting. So again, welcome. We will put House Bill 269 back on the table for consideration. For those of you just joining us, we did not finish that bill during our last meeting, and we left off with public comment. During our last meeting, I did limit public comment to 2 minutes. My good vice chair was the timer. And I would just ask that if our committee members have any questions of those that testify, just keep your questions succinct and brief so that we can listen to everybody. We do have 7 folks online that would like to testify on House Bill 269, naturopathic medicine licensure, and I assume there might be a couple in the audience that want to testify as well. So we're going to call on those in the audience that would like to testify. We've got 3 chairs up here, so come on forward if you would like to testify. Good morning and welcome. Yeah. So you'll need to press the green button for us to hear you and for everybody online to hear you. If you would please state your name and if you're with an organization or just representing yourself, and then whether or not you oppose or support the bill, and we'll hear your testimony for 2 minutes.
My name is Brenda Morgan. I own Balance Prairie Wellness. I'm a nutritional herbalist. I've trained under the Country Doctor for the last 4 years and have been to other herbal schools. I am against this bill. Life is how you control. It put friends or cronies of the government above their competitors. Who was 8 at the time, idiopathic arthritis, or what they were dealing with. 8 doctors couldn't help her, not help her. Thankfully, my mom found the Country Doctor, and over going to appointments there, my daughter is now a healthy, happy 15-year-old. On no medications and has absolutely no trace of the disease they diagnosed her with. They had nothing for her, the medical community, except years of pharmaceuticals and a very sad life. naturopathy has helped her become a healthy young woman, and she will never have to worry about any of that again. And what that did for me was join the natural health practitioner community in Wyoming. And now I have my own clinic where I do the same thing and help people, just like the other naturopaths in Wyoming. We have a wonderful community here. We are all very supportive of each other, always educating and always educating ourselves and our community that we are here to help. Thank you very much for listening.
Thank you for your testimony. Any questions from the committee? Seeing none, thank you for joining us. Okay, anybody else? Okay, going. Okay, seeing nobody, will move to online. Okay. Good morning, Ms. Mitchell. If you'd state your name and who you represent, whether or not you support or oppose the bill, and we'll hear your testimony for 2 minutes.
Good morning, Madam Chairman and members of the committee. My name is Dr. Jessica Mitchell. I am here in support of HB 269. I am here on behalf of the WANMP. I serve as the Dean of the College of Naturopathic Medicine at Sonoran University of Health Sciences, which is located in Tempe, Arizona. The Naturopathic Medicine program at Sonoran University is one of 7 rigorous 4-year medical school programs designed to train students as naturopathic primary care physicians. Our program integrates traditional naturopathy with conventional medicine, offering a comprehensive science-based medical education. This includes extensive training in biomedical sciences such as anatomy, biochemistry, physiology, and immunology, along with clinical and laboratory diagnosis and treatments. Students are thoroughly trained in natural medicine modalities, including botanical medicine, hydrotherapy, nutrition, and acupuncture, while also gaining expertise in pharmaceutical medicine and intravenous therapies. This dual approach ensures that our graduates are equipped to safely practice primary care, including prescribing and adjusting medications when necessary. They are also trained to identify and manage potential interactions between naturopathic treatments and pharmaceuticals. Our program is an in-person, full-time, 4-year medical program that includes 1,200 hours of patient care, completed at our 2 on-site clinics and 7 community health clinics. One of our on-site clinics specializes in non-opioid pain management. This extensive hands-on experience prepares our graduates to meet the complex needs of their patients. Graduates must also pass 2 licensing exams to demonstrate their competence as primary care providers. The first exam, taken at the end of the 2nd year, focuses on biomedical sciences, while the second exam evaluates their knowledge of diagnosis and treatment, including laboratory and imaging interpretation, pharmaceuticals, and naturopathic treatment modalities. In addition, some states require elective exams in IV, advanced pharmacology, and acupuncture.
Ms. Mitchell, you
Supporting
are out of time. I apologize. Thank you.
I'm here to answer any questions.
Yep, thank you for joining us. Committee, any questions of Ms. Mitchell? Yeah, Representative Klauston.
Thank you, Madam Chair. Thank you, Dr. Mitchell, for being with us. You know, there's been a lot of questions even on this committee trying to distinguish between the 2 groups we're looking at. We have people that are going through your school and other schools like you, and then we have our naturopaths, which have been working here in Wyoming for several years, I mean, 30 years plus at least. So can you kind of give an overview of the difference between the 2 groups?
Dr. Mitchell.
Thank you, Madam Chairman and Representative Klauston. I can speak to the training within our program. So our program is a 4-year on-ground, in-person medical school training program. I'm not an expert in the other programs, but I do know that they are not held to the same hours and lengths and training requirements that we are. So our program is 4,100 hours and includes requirements for patient contacts and clinical hours.
Follow-up, Representative Clouston.
Thank you, Madam Chair. And again, thank you, Dr. Mitchell. Just, one other question that I'm struggling with. People from your program are doing IVs, working on prescriptions, minor surgeries, but yet we have this under the Board of Acupuncture. I really feel maybe this should actually be under the Board of Medicine. They're also asking for the ability to determine disability ratings, sign death certificates. There's quite a few things here that the people that train with you are asking to do. So I'd like to know how you feel about this group being under the Board of Acupuncture versus the Board of Medicine, and if you have a preference.
Dr. Mitchell.
Thank you, Madam Chairman, Representative Clouston. I would defer to the state organization to answer that question about the best location for the licensing to reside.
Thank you. Okay, seeing no other questions, thank you, Dr. Mitchell, for joining us. Our next testimony. Welcome, Ms. Gustis. Just state your name and who you're with and whether or not you support or oppose the bill, and we'll hear you for 2 minutes.
Thank you, Madam Chair and members of the committee. My name is Elizabeth Gustis, and I'm a current naturopathic medical student at Bastyr University in Washington State, and I serve as the president-elect of the Naturopathic Medical Student Association. I'm honored to be here today and to represent the international student body of naturopathic medical students and to express my strong support for HB 269. Currently, there are 8 naturopathic medical schools accredited by the U.S. Department of Education, with the 9th school undergoing a process of obtaining accreditation this year. Across North America, there are more than 1,200 naturopathic medical students, over half of whom are located west of the Mississippi River. Naturopathic medical training uniquely equips us to provide holistic, patient-centered care in various fields, including midwifery and women's health, adjunctive oncology care and prevention, and mental health. Granting licensure to naturopathic doctors in Wyoming will increase access to preventative care, primary care services, and holistic individualized treatment for the community. Additionally, licensure would create opportunities for future naturopathic doctors to live and practice in Wyoming. As students, we carefully consider licensure and scope of practice when deciding where to establish our careers. By supporting this bill, Wyoming can position itself as an attractive state for naturopathic doctors to serve and contribute to local communities. Thank you for your time and thoughtful consideration of this important issue. I'd be happy to answer any questions you may have.
Thank you, Ms. Gustis. We do have a question, Representative Wasserberger.
Thank you, Madam Chair. Yeah, thank you for testifying today. I'm just curious, under your practice, do you ever prescribe pharmaceutical medications or do you perform minor surgeries? Is that any type of practice under what you're currently learning?
Ms. Gustis.
Yeah, Madam Chair and Representative, it is something that we are learning. We have extensive training in pharmacology along with our other modalities of botanical medicine, nutrition, lifestyle support, as well as minor surgery. And that can look like things like sutures, if someone bumps their head and that is medically necessary, and smaller minor surgery techniques like that. That is something that we get hands-on practice in clinic and in community clinics.
Thank you. We have a follow-up question. Representative Wasserberger.
Thank you for answering that. And just out of curiosity, do you know if that's kind of a new practice in your guys' field of study, or has that been going on for years and years and years?
Ms. Gustis.
Madam Chair, Representative, this is not something new. This 4-year accredited naturopathic medical program has been around for a long time. And so the naturopathic doctors that you have seated there today and that are bringing this bill to you also have that training in minor surgery and pharmacology.
Okay, thank you for joining us this morning.
Thank you.
If you plan on testifying on House Bill 269, if you're on Zoom, please raise your hand so our secretary can let you in. Good morning, welcome. Please state your name and whether or not you support or oppose the bill, and we'll hear your testimony for 2 minutes.
Thank you, Chairman and Committee. I am Dr. Kimberly Ballas. I have a practice in Casper, Wyoming, and I have been a traditional naturopath, a doctor of naturopathy, for over 30 years. I have a service to our community. I have a host of patients that I am oppositional, very oppositional to this bill. We have seen in other states with this bill being passed of how it does not represent the community as a whole of having choice of a naturopath or someone that wants to do the scope of practice under a board of medicine. So I strongly feel this should be presented under the board of medicine. I do not understand the collaboration with it being combined with the acupuncturist, with naturopaths, as that is two very different scopes in what they want to do. So that is confusing being part of another board. We are not wanting to argue amongst our field. We want everybody to have the right to serve the public. This would impact my business by creating a monopoly. It creates a licensing barrier. It monopolizes currently used titles, and it could potentially make other professions illegal. I work in conjunction with many medical professionals, medical doctors, DOs. I appreciate making that collaboration. I think it serves our public and our community that we rely on each other's field of knowledge for that presentation. I also understand that with the relevance of this combined, we already have groups that are serving the public, as that was mentioned. And again, we want to allow this to become our two different boards existing in the same realm as Idaho has passed. So instead of creating a license barrier, we would like to embrace having every group heard in this with the different fields of practice, the different scopes of practice, and make this more of a linear division with the acupuncturist and the naturopathic physicians. I also run a clinical lab for research and development in the state of Utah under my Doctor of Naturopathy. I also hold 2 other PhDs. So I would oppose this bill and rewrite so that we all have a voice being heard to represent the public. Thank you, Madam and the committee and chairman.
Thank you, Dr. Ballas. We do have a question for you.
Thank you.
Representative Clouston, not doctor, representative.
You can call me doctor, but usually here it's representative, so. Doctor, thank you for your testimony and just trying to, clear this up for everyone. Can you tell me what the training is normally in Wyoming for Doctor of Naturopathy?
Doctor of Naturopathy has an exam and a board and requires a four-year undergraduate degree plus extensive training in order to pass a test. I have extensive training in other areas in the medical field and because of my other PhD. So I've had extra training in that, which I feel like I still would not want to be under this medical association that's being presented. Because I want to create that collaboration with the medical doctors and allow them to do the prescriptions in their field of study. This would cost me thousands of dollars to go back to school, and that is not an option at this point in my career.
Thank you. We have another question for you, Representative Wasserberger.
Hey, thank you for sharing your testimony. So just some of the other folks that talked about studying some of the fields of practices of naturopathy. So as of right now, you have no ability to do like minor surgeries or prescribe any types of pharmaceutical medications. Is that correct?
That is correct, and nor do I want to. I want to continue to work in collaboration with people that have done that for years. And this is not an exclusion of those under a naturopathic bill that want to do that. I just don't see the inclusion of the other doctors of naturopathy in this. So therefore, it creates a licensing barrier and a monopoly.
Thank you. Okay, thank you for joining us this morning.
Thank you, Madam Chairman, and
Okay, Ms. Coombs? Okay.
Good morning,
Welcome.
Madam Chair.
Good morning, welcome. Please state your name, who you're with, and whether or not you support or oppose the bill, and we'll hear your testimony for 2 minutes.
My name is Julie Coombs, and I represent members of the American Naturopathic Medical Association. Not only are we the oldest naturopathic association, with over 4,000 members, American Naturopathic Medical Association represents the majority of naturopathic practitioners in the United States. ANMA members work under many titles depending on the educational level completed. They go to resident and online learning programs that operate legally in the state where they originate. They are not diploma mills, and we are not vitamin salesmen. Many of our members are licensed MDs, DCs, DDSs, and RNs that offer naturopathic therapies in their healthcare practice. So you've heard the AANP's definition of naturopathy, but the National Institute of Health says naturopathy is the treatment of illness by using diet, herbs, exercise, etc., without using standard drugs or surgery. And ANMA and the general public agree with that. Naturopathy and allopathy exist as two totally separate professions. Allopathy and allopathic medicine are the same thing, and so are naturopathy and naturopathic medicine. Here's a fun fact. There's a definition for what they practice. It's integrative medicine. And the National Institute of Health says that's medicine that integrates the therapies of alternative medicine and those practiced by mainstream practitioners of medicine. And allopathic medicine is already legislated in Wyoming, and graduates from these schools cannot qualify for this license. So they come to you asking for help to gain backdoor entry into practicing allopathy in Wyoming without going to a real medical school. Because of this bill, HB 2669, through the title protection, naturopaths currently offering low-cost naturopathy in your state without incident will suffer. Naturopaths yes?
You are out of time. I apologize.
Can I ask for a couple? Can I request a couple of minutes?
I let you go over a little bit. Committee, do you have any questions of Ms. Coombs? Okay, seeing none, I'd like to thank you for joining us this morning and for sharing your testimony.
Thank you, Madam Chair.
Okay. Okay.
I'm not sure if you can hear me. I'm
We
going to go
can
ahead.
hear you. Welcome, Ms.
Oh,
Formby.
okay.
Just state your name and whether or not you support or oppose the bill, and we'll hear your testimony for 2 minutes.
Okay, Madam Chair and Committee, thank you. My name is Julie Formby. I'm a natural healthcare practitioner here in Cheyenne, and I oppose amending HB 269 to include naturopathic medicine. I agree with Senator McCann that traditional and Western medicine has lost its way by focusing on sick care and giving pills versus actually addressing the root cause of health issues. I also agree that we need more options for healthcare here in Wyoming. However, amending HB 269 will not create more options, but rather will do the opposite by restricting naturopathy and naturopathic medicine. And as well, the majority of those who currently practice here in Wyoming, while catering to a small select number of those who narrowly define true naturopathic doctors as one who graduates from only one of 3 programs. How can reducing currently permitted use of the term naturopathic doctor or doctor of naturopathy serve to increase access to healthcare here in Wyoming? It can't. It's a paradox. There are currently no restrictions on naturopathic medicine in Wyoming and 3 other states. Wyoming has been a state characterized by broad personal freedoms and minimal regulation, and we should remain that way as one of the last bastions of freedom within the United States. HB 269 should not be amended to include naturopathic medicine for the following reasons. 1, the creeping overreach of government regulation has already engulfed acupuncture through HB 269, and it needs to be repealed rather than allowed to progress further and to engulf naturopathic medicine as well. Allowing this expansion will mean growth of the administrative state, which is unaccountable to the people, and this bill has an undefined scope of practice, which gives the board a carte blanche to define it in any way they choose. 2, the next step after weaponizing the term naturopathic medicine will be to add a second layer of unelected bureaucrats who are unaccountable to the people through the creation of an interstate licensure compact, as was done in 2015 for medical doctors. 3, as was already mentioned, there are already over 200 regulatory boards and more than 40 compacts in Wyoming, and we don't need more of either one. The administrative state needs to go away. That's why the Department of Government Efficiency has been formed at a federal level. Wyoming should do the same. 4, why is a non-constituent from another state coming to Wyoming to lobby for new legislation? Contrary to claims made on Monday, NDs can practice here in Wyoming, just like the others who testified on Monday are already doing.
Ma'am,
Those pushing the bill.
Miss, you are out of time.
Thank you. Please vote no on HB 269.
Are there any questions for Ms. Farmby? We do have one for you, if you're still there. Representative Wasserberger.
Hi there. Thank you for sharing your testimony, and I just want to get a good clarification. So to my understanding, it sounds like anybody can just move here and open up shop and start practicing naturopathy without any types of government restrictions. Is that what I'm understanding from your perspective?
Ms. Formby?
That's yes, Senator Wasserberg and committee. That's my understanding. According to the ANMA website, it shows which states have no restrictions on naturopathy.
Okay. Thank you for joining us this morning.
Thank you.
All right, committee, we will we'll move on to registered lobbyists. Are there any registered lobbyists that would like to come forward to testify? House Bill 269. Good morning and welcome. If you'd state your name and whether or not you support or oppose the bill, and we'll hear your testimony.
Thank you, Madam Chairman. My name is Sherilyn Kaiser, and I'm representing the Wyoming Naturopaths Association. I'm not doing a full testimony this morning. I just was asked to respond to a couple of questions, and so I won't be taking a lot of your time. Why do we want to be with the Board of Acupuncture? And it's because we really feel that we would have a voice on our board, and as with our scope of practice, with our licensure, and if anything ever comes up that we have to just, discuss as an industry, we feel that we would be, have a bigger voice with the acupuncturists as opposed to the licensing board with the medical board. Put my glasses on, excuse me. We'd like to be governed by our peers and, and individuals that understand our teaching. Our board makeup conveys the governance for professions with pharmacists. And so, it would be able to have that exchange, and we feel that that's extremely important. And then why acupuncture works for us is because we use acupuncture in our care plans. They understand the uses of herbs, and some acupuncturists have primary care in other states. And they also use our modalities. And so that is why this just felt like a good fit for us when we started looking at, licensure, and with our primary goal of licensing our naturopathic physicians and doctors. To clear up, there are 7 accredited schools in North America, and for doctor of naturopathy, and in Wyoming, they don't have a medical degree, and so we think that is probably the differential. And then finally, referring to some of your questions on the minor surgery, only superficial surgeries are done. That's sutures. That's punch biopsies for dermatology and removal of moles. So with that, I could try to stand for questions, and if I can't answer them, I certainly will find the answer out for you.
Thank you, Ms. Kaiser. Any questions of Ms. Kaiser? Representative Wassenberger.
Thank you. Thank you for sharing your testimony. I'm just curiosity. You were talking about minor surgeries such as removing moles. To me, that would seem like something you'd want to do in a traditional medical facility. Why would a naturopath want to have that access to the ability to remove moles?
Ms. Kaiser.
Thank you, Madam Chairman. Representative Wasserberger. Because we are trained for that. And, we go to medical school, or not we, excuse me. Our naturopathic doctors are trained, and it is part of their scope of practice. And with licensure, then our naturopathic doctors would be able to practice at the level of their training. And so they would certainly be qualified to do that.
Additional questions? Oh, you have a follow-up, Representative Wasserberger. Go ahead.
I'm sorry, I'm so curious about this. Okay, so, thank you for sharing that part of the testimony. What would be, so with a naturopathic physician having that practice to be able to do that, because to my knowledge, you're going to the naturopathic physician to get healthy. What health benefits are you promoting by being able to remove a mole? Sorry, this is a lot of stuff that I just need to learn.
Ms. Kaiser.
Thank you, Madam Chairman. To answer the specifics, I'm not qualified to answer those, other than I understand that our naturopathic physicians are trained. And so if a patient needs to have a mole removed, they, want to be able to do that, and they need licensure to do so in the state of Wyoming. And then also, bringing up, insurance and other issues, that we probably haven't touched on. It is, there's a capability with licensure and a training and an expectation, for the safety of the patient.
Thank you. Representative Klauston.
Thank you, Madam Chair. Thank you for your testimony again. Just, one thing in here that I think we need to talk about and clear up. In the state of Wyoming, I'm just going through the list that to work with patients have to get a background check and fingerprinted. So looking at criminal histories, and we're MDs, PAs, RNs, LPNs, CNAs, psychologists, social workers, OTs, PTs, dentists. I mean, the list goes on that you can't practice in Wyoming without doing a background check and fingerprints. Your bill is saying may do that. I mean, I really wonder why it would be a may and not shall if we're gonna let this profession work with patients.
Ms. Kaiser.
Thank you, Madam Chairman. Representative Closton. The original bill, as it is right now, has a background check requirement, and it's a shall. We worked with individuals, and we've been trying to work with any of the impacted, industry and any of the stakeholders. And there were some, thoughts about, perhaps shall, so we don't have any kind of hiccups with licenses, as people come in, and the board would be able to, approve a license, with that timing, because I guess it can take up to 3 months to a year for that process. And so with that we were working with that. It's a suggested amendment. We are fine with the background check.
Follow-up, Representative Clouston.
Thank you. And then, thank you, Madam Chair, and thank you. So background check, and like all these other professions, Wyoming, it would be the fingerprints as well, not just, okay, thank you.
Okay. Vice Chairman Ottman.
Thank you, Madam Chairman. And I'm sure you all feel like you have gone over this and over this, but what I need clarification on is there's the naturopathic homeopathy, and then there is this that you all are talking about, and then there's medical school professionals. Should it be 3 different categories rather than 2? And why doesn't medical school teach more of the naturopathic? Since is it because it's medicine pharmaceuticals?
Ms. Kaiser.
Thank you, Madam Chairman. I think I could try to answer the question. You're talking about tiered licensing with different professions, as I understand it. The original intent of this bill was simply to license our naturopathic physicians. That is the original intent. We thought that with the bill that we had taken out the other disciplines, and in saying that we are not trying to impact their ability to, provide services in the state. I think if you want to look at a tiered licensure, that's a policy decision of the legislature. And, and certainly something we would want to be part of if you had, those future conversations. But for right now, we would really, ask that you support the licensure of our naturopathic physicians. So some of our members can come back home and start, practicing in Wyoming at the scope of their practice at their education level.
Thank you, Ms. Kaiser. Okay. Thank you for joining us.
Thank you very much.
Oh, we have another question, sorry.
I've got a follow-up.
Okay,
Thank you, Madam Chair.
Representative McCann.
Just to clear up some of the dermatology thing, usually if you see a suspect mole, they're thinking cancer, so they want to biopsy it, send it off so that they can be evaluated. And it's really just, it's a little ring blade. You just spin it down and you're basically just taking a plug of skin out, and then you put a stitch in it. So it's very, very minor, if that helps answer your question.
Representative
I forgot the other
McCann,
one. Thanks.
do you have any questions of
Oh, I'm sorry, I made,
the registered
no,
lobbyist?
I do not.
Okay.
Sorry.
Any other discussion we'll save for
Okay.
discussion
Sorry,
on the
ma'am.
bill. So thank you, Ms. Kaiser, for joining us.
Thank you very much.
Not so fast. We have one more question. Representative Wasserberger.
Thank you, everyone, and thank you so much for your patience, everybody. Just to get a clarification, you were saying that this would allow for some of the folks that you work with to be able to come here and practice. Now, considering that other people have testified saying that they're already practicing here, they did not have to do any licensing, but you've got people that maybe are in this field where they do naturopathy, but they also are able to prescribe minor medication, minor surgeries. Why wouldn't they be able to just get why is it that right now they can't just get licenses for that and be able to come here and still do their naturopathy. And as far as having another question, a follow-up to that, my second question, as far as being able to have a voice with the Board of Medicine and things like that, what's stopping you from having a voice exactly right now? I just spoke with a naturopath physician that's from here in Wyoming. I literally just got his phone number because I'm interested in helping our naturopathic physicians, but I also don't want to be making a big crutch. And the third question is, so you're interested in doing the licensing. I'm hearing from the folks that are in opposition that this is going to ramp up their costs. Would this ramp up your costs, or do you think this would not ramp up their costs? If you can, sorry, I know I just gave you a kind of a bunch of word salad there, but.
Ms. Kaiser, if you
Thank you,
can
Madam
answer
Chairman.
those to the best of your ability.
Representative Wasserberger, I will speak to this as my best of my ability. As far as, being able to practice in the state of Wyoming. Right now, with our naturopathic physicians, the training is different, and so there's a higher standard. And so with, because they do go to medical school and they are doctors, by, accredited education, by the Department of Education. So it's specialized. And so you have your levels of if we do have some naturopathic doctors who do practice in the state of Wyoming, and Dr. Sean Palmer from Laramie could probably speak to that much better than I can. So if we could talk about it, after the meeting, we'd certainly enjoy doing that. As far as costs, accessibility will certainly help the, patients. And if with licensure, we could have insurance and somebody could qualify for insurance. And so, that's a process with insurance companies, but, that would be the start of those conversations. And I do know that costs vary from around the state. But, and practicing at a primary care level, I can't answer to what the cost would be because we're not doing that right now. So.
Thank you, Ms. Kaiser. Okay. Thank you, ma'am, for joining
Thank
us
you
this
very
morning. All right. Any additional registered lobbyists? Okay, the seats are empty. I will close public comment on House Bill 269. Committee, what is your pleasure? The bill has been moved by Representative McCann. Seconded by Representative Gugemas. Discussion on the bill and/or amendments. Representative Clouston.
Madam Chair, and to the committee, I guess I have a procedural question. Lots of questions on this bill, and I think it needs a lot of work. What's the procedure to table this as an interim topic?
Representative Clouston, it would be a motion by any committee member.
Madam Chairman.
Representative Yin.
Yeah, so procedurally, the motion, if you wanted to table the motion that's on the table, so we have a motion on the table of a due pass for the bill. If you wanted to table that motion, it would just be, you would say, I make a motion to table this indefinitely so we can have the discussion over the interim, if that's what you wanted to do.
Is there a motion on the table right now to table it?
Representative McCann.
Madam Chair, before we go that route, I'd like to present some amendments for this, which basically hopefully will address all this stuff. And if I may have my presenter come up and explain those. Her and her co-sponsor, or her and her cohorts have been working diligently to try and get this worked out so that we can all hopefully find some middle ground. And then if you choose to do that after this, then I'd be more open to that.
Okay, so committee, we do have a proposed amendment from LSO, which is a simple typo. And then Representative McCann gave you a handout of amendment ideas as the bill sponsor. And then we did get another handout that was emailed to the committee members that came from ANI based on their testimony last meeting as well. So those were emailed to you on Monday. So Representative McCann, if you would like to make any motions for amendments, now would be the time.
Thank you, Madam Chair. These may look like lengthy amendments, but as we go by page, you'll see that addressing stakeholder and citizen concerns. We are removing the lay naturopaths completely. We are requiring that they just cannot use the license in their title, which they aren't licensed anyway. They don't want anything to do with that. And I don't blame them. I'm actually on their side as far as that goes. This bill will not impact how they do business today, every day forward. As a sponsor, my primary goal is to license naturopathic doctors to their level in the state, not impact other businesses. Madam Chair, I'd like to ask Dr. Marks to come up and explain the amendments, if I could, please.
Representative McCann, if you would be willing to just move your amendments and walk us through. These are very, very lengthy. My hope is that the committee has had time to review these. You would be the one moving those amendments and walking the committee through them.
All right, I'd like to propose amendments for House Bill 269. Okay.
Is there a second on Representative McCann's amendment? Okay, seconded by Representative Gugemas. Go ahead, Representative McCann.
Okay, section 1, just definitions. Naturopathic physical medicine means the use of one or more of the following physical agents in a manner consistent with naturopathic medical practices on a part or whole of the body by hand or mechanical means in the resolution of the human ailment of conditions. Then there's a list there: air, water, heat, cold, sound, light, electromagnetism, colon hydrotherapy, soft tissue therapy, therapeutic exercise, naturopathic manipulation. Naturopathic therapy means the use of naturopathic physical medicine, suggestion, hygiene, therapeutic substance, and legend nutrition. And food science, homeopathic medicine, and clinical laboratory procedure. Definition of minor office procedures means the use of operative electrical or other methods for repair and incidental care for superficial lacerations, abrasions, superficial lesions. Legend of the drug, unscheduled and prescription drug. Found with nutrition and food science, homeopathic medicine. Laboratory examination means phlebotomy, which is taking blood. Clinical laboratory procedure and general physical exam. Function tests. Okay. Going on to page 7, line 7, insert standards of practice. A large area there. In the essence of time, if anyone has any questions on that, I'd be happy to answer that. But that's standards of practice, scope of practice. Duties and authorities of naturopathic physicians and those definitions. Finally, the prohibitions. Licensed naturopathic physician under this chapter shall perform surgical procedures except those minor office procedures authorized by this chapter. Goes into that list. Page 8, line 18, delete naturopathic doctor, insert license before naturopath, after ND, add or licensed naturopathic doctor, page 10, line 11, insert certified traditional naturopath is certified by the American Association of Natural Wellness Practitioners, American Natural Wellness Practitioners Board, International Association of Naturopath Practitioners, or any other related natural health care. And I'm missing something here. Oh, page 13, lines through 15, 8, delete, which (15 through 18), I'm sorry. An applicant for licensure under this act shall provide the board with fingerprints and other information. The lobbyist went over that. What I'm missing is where we take, I'm sorry, I was expecting. The last one? Oh, that, what I was trying to find specifically was that we do take the traditional naturopaths, for lack of just to differentiate, I'm not trying to take anyone's title away, that they can keep their titles. We basically have exempt them from the entire bill. They're not determined, they don't have to get more education, they don't have to get licensure or anything. We want them to keep their own entity the way it is, and they can keep their titles as far as that goes. So I apologize, I wasn't ready for that. I was hoping to have some help.
Thank
So,
you.
Thank you.
Representative McCann. Any questions for Representative? Yes. Mr. Caldwell?
Yep, Madam Chairman, is this a document of amendments?
Yes.
Would I be able to receive a copy?
Oh, my apologies. I assumed you had one. Okay, any questions on the Representative McCann's amendment? Representative Clouston.
Thank you, ma'am. This is quite the document. I'm on, I guess they're not numbered, but 1, 2, 3. I guess page 4, there's not line numbers on here, but a little bit past halfway down, it says, licensed naturopathic physicians may admit patients to a hospital at which they're credentialed and privileged to. And then on the bottom of it, it says a naturopathic physician may sign and attest to any certificates, cards, forms, or other required documentation that a physician may sign. And we heard in testimony that they want to work as primary care physicians. Again, I'm just going to tell this board, I really feel strongly that this needs to be under the Board of Medicine. If we're going to be treating patients in hospitals and giving the same rights as a primary care physician, this should be under the Board of Medicine and not under the acupuncture board. I think so I guess discussion on that, that's.
Further discussion on the amendment. Vice Chairman Ottman.
Thank you, Madam Chair. Just to say, first off, I think that I was so excited when this came because this is the type of, this is what we do in our family. And then to say, okay, these other folks that are already doing things are not under this, that's good. But I don't see that, and there's a lot of pieces here that isn't very clear. We certainly do need people in our communities. There is no doubt about that. And the reality of naturopathic medicine, or I would just say treatments, is phenomenal and well needed, especially when we see all the side effects and things like that. But right now, with the confusion, at least in my mind, in my heart, I would like to see this studied a bit further and brought back. So.
Thank you, Vice Chair Ottman. We're on the amendment. Further comment on the amendment. Representative Wasserberger.
Okay, so on, I guess, page 3, we're looking at, you get to the middle of the page here. And so as it states, after passing the CNME pharmacy add-on exam license, naturopathic physicians are authorized to dispense, administer, and order all legend drugs, which, and I understand a lot of that tends to be pretty minor stuff, but I'm seeing here that we've got prescriptions for things like testosterone products and drugs within schedules 3, 4, and 5. Why are these testosterone supplements or drugs, are they natural? And why would a naturopathic physician be needing that capability? I don't know. Normally, the things that are typically prescribed in your pharmacies just really aren't a natural path, from my understanding. Is there any
Representative McCann.
clarification?
Part of this branch of medicine is that they also do hormone optimization. So again, what I would call the naturopath practitioners, just for differentiation. They do it with herbs. There's plenty of herbs and other things that, can affect testosterone. So they do it with natural ingredients. Whereas the naturopaths typically start out with that. If it doesn't really help, then they can go to the testosterone supplements. It's just TRT, testosterone replacement therapy for male menopause type stuff.
Additional questions on the amendment or discussion? Okay, seeing none, all those in favor of Representative McCann's amendment, please raise your hand and state aye. All opposed? Okay, Representative McCann's amendment has failed. We do have another amendment that I will move on behalf, that was provided by LSO. On page 6, line 3, before years, insert the number 2. Is there a second? Seconded by Representative Yin. Any discussion on Chairman Rodriguez Williams' amendment? Representative Yin.
Just to clarify for the public and everyone else, this is just an LSO typo that our statutory construction, whenever we put in the number 2 written out, we always have the digit as well. And so this is just adding that digit back in. That's all it is.
Thank you, Representative Yin, for the clarification. Okay, any discussion on the amendment? Okay, seeing none, all those in favor of the Representative McCann?
May I?
We're on the next amendment. Yeah. Apologize. Okay, so all those in favor of Chairman Rodriguez Williams' proposed amendment, state aye. Aye. All opposed? Okay, that amendment has passed, and I believe, Mr. Caldwell, you have a copy of that. Okay. All right, we have, or is there any more discussion or amendments on the bill? Again, we are on House Bill 296, working the bill. Representative Gugamas.
Thank you, Madam Chair. I just want to say I like the intent of this bill. However, this is a complicated, many-faceted situation. We're dealing with multiple types of practitioners that cover different areas and things and use different methods. Like I said, I like the intent of this, and I think this is worthy of additional time to, what I would like to see is I'd like to see representatives from each field come together and we can work on crafting legislation that all parties are involved, and hopefully we can get it to where everybody's happy and comfortable with where this goes, so we don't step on any toes or cause more problems in the future that we would have to then go back and try to fix. Thank you.
Thank you, Representative Gugamas. Further discussion on the bill or amendments? Representative Wasserberger.
So, yeah, and I would have to agree with what you have to say there, Gugamas, Representative Gugamas. I don't think this bill is necessarily dead, but just from my perception of getting all the different testimonies, it seems like there's maybe two different, almost like as if there's two different definitions of a naturopathic physician, because I've gotten to hear from some that claim to be naturopaths that don't really have those, told me that they never have done a minor surgery or prescribed a pharmaceutical, and then there's other ones that are arguing that they are. So that's just kind of the concern I have at this point in time, is having just one word and just treating everybody the same. And then you've got people who have called themselves that for several years, and then they've got a totally different scope of things that they've got to make sure that they're up to date on. And so, I mean, I don't think this bill is necessarily dead. I do believe the intent was to make it more accessible to naturopaths. I think a lot of us on this board have been pretty unhappy with traditional medicine, and we want to give other options to the public. But at this time, I think what would be the best option is to go ahead and table this and to make it one of our pet projects over when we're out of session. I went ahead and got a phone number from somebody that's been practicing for a while here, and as a naturopath, he said there is solutions to making this bill better. And so I'm gonna plan on bringing him to kind of give us some help on this. And I just think right now at this time, we just need to work on it a little bit more. But I mean, I do appreciate the intent you have, and I understand where you're coming from. And so I think we can do something to make it a very good bill.
Thank you, Representative Wasserberger. Any further discussion on House Bill 269? Okay. Seeing none,
I'm sorry, can I make a motion that we table this bill for now?
okay, a motion is been moved by Representative Wasserberger to table the bill. Seconded by Representative Gugamas. Okay, by a show of hands and a voice, all those in favor of Representative Wasserberger's motion to table House Bill 269, please state aye. Aye. All opposed? Okay, committee, thank you. Good work. Thank you to those who testified on it. We will move on to our next bill, which is House Bill 188, titled Two Families, One Nanny, sponsored by Representative Yen. If you'd take the chair.
Yes.
Good morning and welcome, Representative Yin. Thank you for bringing us your bill this morning. If you would please walk us through your bill, give us an explanation.
Madam Chairman, members, I bring you House Bill 188, 2 families, 1 nanny. So this is what we call a simple little bill, a good little bill. So members, in childcare licensing, there's a big catch-all of what is considered a childcare facility, and so I'll read it. It says, any other person not legally related to a minor having legal or physical care, custody, or control of the child, receiving payment therefore, and not supervised by the state, government, school district, agency, or political subdivision thereof. So there are a bunch of exceptions of things that are allowed. So for example, you are allowed to have a nanny to watch over your kids, or a babysitter to watch over your kids. We have an explicit exception for watching over the kids of one family. Once you get into multiple families right now, in our statute, you are required to be licensed as a child care facility. And so all this bill does is provide a new exception. If you're watching over up to 2 families, up to 4 children, with no more than 2 of them under the age of 2, you can have a nanny. So that's why the title is essentially 2 families, 1 nanny. I do know that there are people that are doing this right now. I don't think they realize that they're breaking the law, nor do I want them to be breaking the law. And so I have this in here with just those slight little guardrails to make sure that there isn't excess risk to really little babies. And with that, that's the bill. Happy to answer any questions, members.
Thank you, Representative Yin. Committee, any questions regarding the bill for the bill sponsor? Representative Clouston.
Thank you, Madam Chair. Thank you, Representative Yin. By passing this into law, are we allowing any extra benefits to families utilizing this care? Is there something we're missing here? I mean, it seems like a pretty simple bill, but I feel like we've heard it before and there's been some pushback. So just wondering if there's some extra benefits that this would allow families that I'm not aware of.
So, Madam Chairman, and members.
Representative Yin.
Thank you. I mean, I think the issue is that right now, if you have a nanny taking care of your kids, that nanny doesn't have to be licensed under our child care licensing regime. But the second you add 1 more kid in there from another family, it does. So there is risk once you start adding more kids, for sure. But I think there are plenty of people, you know, I might have a brother with another kid and I want them to take care of both of our family's kids. And I think that happens a lot. And so again, that's all it is. It's not, I think we've had other bills that get a little bit broader in the number of kids or the families of kids. But this one's pretty tight under basically just an exception for 2 families. And this did come from me from someone who realized that this was an issue and they didn't want to be breaking the law.
Thank you. Additional questions of Representative Yin? Oh, Representative Gugma, or Wasserberger.
Okay, thank you, Representative Yin, for bringing this forth. So as of right now, you're trying to say that if you have more than 4 kids, the nanny is required to be licensed?
Representative Yin.
Madam Chairman, Representative Wasserberger, yes, because within our child care licensing rules, and this is things that we've debated many times, that there's a significant change when you have 5 or more kids. And that's not really in the bill, that's in existing language around our childcare rules. And so I just didn't want to get into this territory where we have special childcare rules for multiple families with 5 kids, but then don't have it for this one. So that's all it is. It's just a little bit of trying to align it with existing stuff that we do have.
Any additional questions from the committee? Vice Chairman Ottman.
Thank you, Madam Chairman. Representative Yin, could you just clarify for me or maybe repeat? This person doesn't have to be licensed. They're a nanny, is that right? And so this would allow them to legally take care of these children, is that?
Representative Yin.
So Madam Chairman, right now, if you are a nanny for a single family, you are exempt from all of the childcare facility licensing. If you are a nanny and your family wanted to add another kid, you would technically have to get licensed in our current law.
Additional questions of Representative Yin. Representative Wasserberger.
So, thank you, Representative Yin. So is that this is your intent, right, is to make it to where you've got, let's say you have 4 kids and then your brother wants to use the same nanny that you have hired to bring on 5. That's the intent, right?
Representative Yin.
Madam Chairman, Representative Wasserberger, no. So the intent is you're a quote unquote nuclear family with 2 kids. Your brother has 2 kids. You want a nanny to take care of all 4. It doesn't exempt you from it being unlicensed if you have more than 4.
Any additional questions, committee? Okay, seeing none, thank you, Representative Yin. Are there any government agencies that would like to come forward on House Bill 188? Good morning. Welcome. If you'd state your name and your take on the bill here.
Good morning, Madam Chair, members of the committee. My name is Roxanne O'Connor. I'm the Support Services Senior Administrator for Department of Family Services. Support Services oversees childcare licensing in the department. And really, we're neutral on the bill, but here to help answer any questions that we can.
Thank you, Ms. O'Connor. Any questions, committee, for DFS on the bill? Okay, seeing none, thank you for joining us.
Thank you, Madam Chair. If I might be able to address Representative Wasserberger's question, his
Sure,
initial
absolutely.
question about
Please.
the number of children and family units required to be licensed and those that are exempt. Right now, in our current statute, we have essentially 2 exemptions that fall under your question. One is if there is an individual that's looking after one family unit, regardless of immediate family unit, regardless of the number of children, they would be exempt from licensing. The other exemption would be if there is one person watching 2 unrelated children, they would also be exempt from licensing.
Thank you. Follow-up, Representative Wasserberger.
And so that's what this bill would intend to do, is make it to where you've got I'm a dad, I've got 2 kids, I've got a nanny hired, and that nanny would like to take on 2 additional kids that aren't even other family but just, she's trying to make a living. And so this would make it so she doesn't have to get that licensing to have up to 4 kids, correct?
Ms. O'Connor.
Madam Chair, yes, that's correct.
Thank you.
Any additional questions? Okay, seeing none, thank you. We will move on to public comment. Is there anybody that would like to testify on House Bill 188? Please come forward. We have 3 chairs open here. Nope, come on up. Let's occupy all 3 chairs so we can move along. Thank you. Good morning and welcome. If you state your name and your take on the bill here.
Here we go. Good morning, Madam Chair, committee. My name is Micah Richardson. I'm with the Wyoming Women's Foundation. And I am going to put in a small request. I have a person from Du Bois who may be on the line, but wasn't able to sign up to testify. Is that a possibility for her to testify alongside with me on this, if she is on the line?
I would refer to Mr. Caldwell. We do have a deadline for registering. It's usually an hour before committee meetings. So if she didn't get registered, I would just encourage her to maybe email the committee, because sometimes questions come up on the
Great.
floor.
Yeah, she got a little confused with the dates. So I will kind of try to speak for her as well. So we all know that childcare is a real big issue. And the Wyoming Women's Foundation has been working alongside a lot of other organizations and individuals to try to work on this issue. We know that something like this can really be beneficial when there's an emergency situation. And so in Du Bois, for example, their one child care facility closed very suddenly. As I was working with some of those moms there to figure out what does this look like, how do we fix this, one of the solutions that came up was nanny sharing. As you know, Du Bois is really remote. There aren't a lot of folks there to offer services. And so in speaking with DFS, we learned that only one child from one family, one child from another could come together on this. This would have, in that emergency situation, been really helpful, at least for a few families, and potentially getting some more nannies in to help just to kind of bridge that gap while they figured out what in the world they were going to do. What we really appreciate with this bill is that it does have a cap to it, so that we're really still thinking about the safety of those kiddos. I don't know about you, but if I have more than like 4 or 5 kids at my house running around, is a little bit overwhelming. And so we really appreciate that piece. And we know that this isn't the solution. It's going to take a ton of different approaches to figure out childcare in Wyoming, but we really like that this is a kind of simple solution, especially in these emergency situations where families are just kind of left thinking, what in the world are we going to do? So again, we're grateful that this bill seems to expand on the number while keeping safety in mind. That safety piece is just hugely important. And I stand for any questions.
Thank you. Any questions of Ms. Richardson? Yeah, go ahead, Representative Klauston.
Thank you, Madam Chair. Thank you, Ms. Richardson. Just for clarification, when you say the one child care facility in Du Bois closed, are you saying that was the one and only?
Ms. Richardson.
Madam Chair, yes. It was the one and only, and that is not unique, I would guess. Maybe Ms. O'Connor could answer that, but some of our very tiny communities, that is what you see. And sometimes we have home care providers, which is fabulous, to kind of fill in that void or pick up the gap, but that was not the case in Du Bois.
Thank you. Any additional questions of Ms. Richardson? Okay. Thank you for joining us this morning. Good morning. Please state your name and your take on the bill.
Abigail Bodewines here as a private citizen. I wanted to testify in support of this bill. I think it's incredibly important in terms of providing childcare security, and I call it that because as a working mother, if I don't have childcare, I can't work. This really would have impacted my life. I had a baby first year who was on oxygen his whole year. He was not in a safe environment at a childcare center. But it is incredibly hard to find childcare for newborns in this town because of the ratios and just insurance requirements. Not a lot of people offer that service. He was in order to keep other kids safe from his oxygen tank, the center was allowing him, they had 8 babies in there, they would strap him into a bouncer and he would sleep there. That's what he did. So I searched for options and I started looking into, well, maybe I can do a nanny. Well, to hire a full-time nanny, your paying rate is $18, $24 an hour to get someone that's talented. And so you're looking $4,000 to $5,000 a month. Currently daycare for 2 kids, I pay $2,000 a month. So by allowing 2 families to pool their resources to hire one person, you're gonna bring that cost more in line to what childcare would be if you were to put them in a center. So I really urge you to support this bill with your colleagues and to just make this an avenue, an option for parents so that if something happens to childcare or they're in an unsafe situation, they have these sort of tools that they can use to provide care to their children. Any questions? Happy to stand.
Thank you. Yep, Representative Klauston.
Thank you, Madam Chair. Thank you, Ms. Bodewines. Is that you? This is not easy to come testify in front of us and tell your story, so thank you for being here. I guess my question would just be, how's your child doing now?
He is
Ms. Bodewines.
He's off oxygen, Madam Chairman. So yes, and he's in a wonderful daycare that we've been able to find, but it's a hard business. So anything this committee can do to help childcare in the state for both we're on the board of the daycare and they do a wonderful job, but the profit margins are so slim, and any day, something could happen. And so I think just having tools helps us as parents.
Thank you. Additional questions? Seeing none, thank you for joining us this morning. Any additional public testimony on House Bill 188? Okay, seeing none, are there any online? Okay. We will move on to registered lobbyists. Any registered lobbyists? Okay, seeing none, I will close public comment on House Bill 188. Committee, what is your pleasure? Okay, the bill has been moved by Representative Heft and seconded by Vice Chair Ottman. Discussion or amendments on the bill?
It seems like,
Representative Wasserberger.
it seems like this bill's going to go in the favor that I would hope it would. I would encourage a support in this bill. My mother actually did daycare for about 30 years, and because of the regulatory hurdles, she finally gave up on the business because they just regulated and regulated and regulated. And I actually do think this is the first step in the right approach to making childcare not such a big hazard. I know in my hometown of Lusk, they have about 1,200 people and everybody is scrambling because they can't find childcare. So I would encourage everybody to support this.
Thank you. Additional comments? We've got lots of, Representative Clouston.
Thank you, Madam Chair, and thank you everybody for their testimony and Representative Yin for bringing this. Child care in Wyoming is a huge problem. Ms. O'Connor is a great resource, and you're going to see a lot of her in the next 2 years because this is something we've been trying to tackle. It continues to be a problem, and so I think any of you that when your constituents reach out to you on this subject, take it very seriously, and it's one of the roles of this committee to try to solve this problem for Wyoming. Thank you.
Thank you. Vice Chair Ottman.
Thank you, Madam Chair. Just a comment. It is, and I was aware of the trouble up in Du Bois, but I didn't know who to approach about it. So I just wanted to thank Representative Yin. I wish we had done this a year ago. And so I guess the time is now. So thank you. And I'm for the idea. I think it's very pro because going through the pandemic, lots of people were out of work and therefore the daycare didn't have the business that they would have normally had. So they were hurting there, but teachers were not working. So it created a vacuum and it was very, very difficult for everybody. So this is a great step in the right direction, I think.
Thank you, Vice Chair Ottman. Okay, any amendments to the bill? Okay, seeing none. Mr. Caldwell, if you would call the roll on House Bill 188.
This is a roll call vote for House Bill 188. Representative Clouston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann. Representative Ottman.
Aye.
Representative Stivar. Representative Wasserberger. Aye. Representative Yin.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 8 aye and 1 excused.
Okay, House Bill 188 has passed our committee. Representative Yin, be prepared to present that on the floor. Okay, we will move on to our next bill, House Bill 273, and place that on the table. I am the bill sponsor, so I will turn the chair over to the good Vice Chairman Ottman.
Thank you, Madam Chair. Committee, we will be looking at House Bill number 273. Okay. 10. Okay. Okay, House Bill 273 is now, no, we're not considering it. Representative Chairman Rachel Rodriguez Williams, are you going to present the bill?
Madam Chair, thank you. My name is Representative Rachel Rodriguez-Williams, House District 50, and this morning I bring to you House Bill 273 titled Wyoming Pregnancy Centers, Autonomy and Rights. And with your permission, I do have a co-presenter joining us via Zoom, if you would consider allowing her in to co-present with me.
Yes. Would you please state your name and go ahead and testify? Yes.
Good morning. I'm Denise Burke. I'm Senior Counsel with Alliance Defending Freedom, and I will co-present on House Bill 273 with Chairman Rodriguez-Williams.
Thank you, Madam Vice Chair.
Ms. Burke, please go ahead. Oh, I'm sorry. Representative Williams, please go ahead.
Thank you, Vice Chair Ottman. I bring to you House Bill 273 and would like to walk you through the bill as to what the bill does. This bill is called the Pregnancy Care Center Autonomy and Rights of Expression Act. The acronym for it is the CARE Act. The CARE Act protects pregnancy centers by prohibiting state and local officials from forcing a pregnancy center to perform or refer a woman for abortion. Furthermore, it ensures that state and local officials cannot prohibit a pregnancy center from providing pregnancy care, counseling service, or any other service related to pregnancy, prenatal care, postpartum care, simply because it does not perform counsel in favor of or provide referrals for abortion. The act also prohibits state and local officials from seeking to limit the free expression and free association rights of pregnancy centers. Inside the bill, it provides a legal remedy for pregnancy centers when their rights are violated. Otherwise, centers may be left with no recourse when the government tramples their rights. So the why the bill? Pregnancy centers are increasing their life-affirming impact in the post-Dobbs era, and the threat to pregnancy centers is real and it's growing. States and local governments, often with the encouragement and cooperation of abortion advocates, are increasingly considering measures restricting the free speech and religious freedom of pregnancy centers and taking actions that threaten to eliminate or limit the positive impact of pregnancy centers on women, babies, families, and the communities they serve. A little bit about the numbers. In 2023 and 2024, more than 30 measures were introduced in 18 states attacking pregnancy centers. So this bill essentially, committee, is a preventative bill. And I would like to turn the explanation of some of the content of this bill over to my co-presenter.
Thank you, Madam Chair, members of the committee. As Chairman Rodriguez-Williams stated, this bill is to protect and prevent future incidents where the rights and the work of pregnancy centers are threatened. If you look specifically at section 35(4)1103, I'd like to point out an important aspect of this bill. This protects pregnancy centers from discrimination simply because they do not provide, refer for, or counsel in favor of abortion, abortion-inducing drugs, or contraception. It is not, as some are trying to couch it, a blanket immunity for pregnancy centers. It simply prevents them from being discriminated against because of their pro-life ethic. And the specific items listed here in the bill include some things that we have seen occur in other states. As Chairman Rodriguez-Williams mentioned, we've had 18 states consider at least 30 measures over the last 2 years attacking pregnancy centers, and 5 of those states actually adopted those measures. So the threat is real. The instances that we list in this particular section are things that we have actually seen happen in other states.
Thank you, Ms. Burke. Representative Rodriguez-Williams.
Thank you, Madam Vice Chair. I would just add on as well that we do have a good amount of pregnancy resource centers that do exist within the state of Wyoming and do provide life-affirming services. So the need for this bill is there, and I would stand for any questions, and so would my co-presenter.
Committee, any questions? Representative Clouston.
Thank you, Vice Chair Ottman. Been practicing that. Thank you, Madam Chair, for being here and bringing this bill. Just curious, in Wyoming, are our pregnancy centers all privately funded? Are they publicly funded? Are they a mixture? Do you know?
Thank you, Madam Vice Chair Ottman, Representative Clouston. Each of the pregnancy resource centers within the state of Wyoming are their own individual nonprofit organizations, with many of them with religious language in their filings with the IRS. There is language in there. To answer your question, most of them rely on private donor funding. Some of them do apply for various grants through local entities. It varies with each center.
Additional questions? Thank you. Not having any other questions, are there any other government agencies that wish to speak? Okay. Seeing none, are there any, is there any public comment? Please state your name and if you're with someone, and you'll have 2 minutes. Thank you.
Thank you, Vice Chair Ottman. My name is Jeanette Ward, and I'm speaking on behalf of myself. I've often heard the argument from the pro-death crowd that if one is pro-life, one needs to support pregnant women with government entitlement programs. These pregnancy centers, one of which I support in Casper, provide services that would be provided by government entitlement programs and are providing clothing, diapers, food, counseling, and many other forms of support. I am in full support of this bill.
Thank you, Ms. Ward. Any other testimony? Any other public testimony on this? Please state your name and who you're with. Thank you.
Thank you, Madam Vice Chairman and Committee. My name is Nathan Winters, President of the Wyoming Family Alliance. I just want to rise in support of this legislation. I think that it's very helpful and has been in many places. It's really good for Wyoming to have this in place to provide the care and support, protection for these kind of centers. And so with that, I stand for any questions. Thank you so much.
Committee, any questions? We have public on Zoom. Oh. Yeah. Okay. Please state your name and who you're with.
Good morning, Madam Vice Chair, committee members. My name is Steve Milia from Cheyenne, Wyoming, and I stand in support of this bill for every reason that is listed under Section 1 and Section 2, etc. And I was a volunteer at the Life Choice Pregnancy Center here for a couple of years, some time ago, and I noticed that they did excellent work, that they provide all kinds of training, supplies before, during, and after birth. They're very supportive of women. When women go in there and they're pregnant, when they leave, both they and the child leave. You know, there's definitely a life section there. And I noticed that under Section 1, subsection V111, there'd be 8 and 9 also, that there's been a lot of violence against pregnancy centers, both verbal, physical, et cetera. And we don't want that to happen here in Wyoming. We don't want, I know in California, I think it was state legislature said that pregnancy centers had to advertise, post, refer for abortions, and really restricted what they were doing. And that they, across the country, they are really demeaned in what they're trying to do. And I know that from my own personal experience as a volunteer, that they really care for women, really care for the fathers also. They have training for the guys. And I must say, us guys really need to step up, because the only way that ladies get pregnant is because of us. And we need to have support for them, and these centers do that. And I stand support in this bill, and I'm glad it's coming forward. Thank you.
Good morning. My name
Please
is
state
Linda,
your name.
and I'm Linda Burt, and I'm with Wyoming Right to Choose, and I apologize for my froggy throat this morning. I'm going to speak just a little bit about the legal issues involved in this bill. First of all, the bill is not, does not raise the question about the centers, whether we support them, whether we don't support them, whether we want them or don't want them. That's not the issue in this bill. Basically, this bill is not only unnecessary, it's unconstitutional. And basically, it's unconstitutional based on the fact that it's special legislation for an individual nonprofit corporation. These organizations are controlled by the same laws that every other nonprofit is controlled by. The Supreme Court has supported their right to speech. Their right to free speech is absolutely protected under Supreme Court cases. It has been protected up to the fact that they may give information that's not correct. They may give incorrect medical information under the constitutional cases. The most recent one was 2018. So those cases have established that there is a free speech right and protection for these pregnancy organizations. That's the first issue that makes this totally unnecessary in terms of any kind of protections. What we don't know, it said that there were 5 cases that states passed in regards to these centers. What we don't know is what those cases were about. And if they denied any free speech to organizations, any pregnancy organizations, they are unconstitutional, and they will be overturned by the Supreme Court. And I think you all know that the Supreme Court now that we have is more likely to support these centers than the Supreme Court that we had in 2018, and they supported these centers. The other issue in this bill that's unconstitutional would be on page 11. It talks about, by legislative order, the legislature may appoint 1 or more members to intervene as a matter of right in any case in which the constitutionality or legality of this act is challenged. The fact is that this is a separation of powers issue. The legislature does not have the right to tell the courts what to do or who has standing in different courts in different cases. So this is an unnecessary bill. It's unconstitutional.
Out of time. Thank you very much. Yes,
Thank you.
thank you.
I do stand for any questions. Thank you.
Thank you. Any other testimony? Any other public testimony? Okay, do we have some on Zoom? Okay. Thank you. Please state your name and who you're with, and you'll have 2 minutes.
Thank you, Vice Chair. My name is Britt Borrell. I'm calling in from Casper, Wyoming as a concerned citizen to voice my strong opposition to this bill. I find it ironic but unsurprising that this body feels it necessary to try and shield True Care and other crisis pregnancy centers from regulation when it feels no shame in trying to shutter Wellspring via legislation, a center that provides actual healthcare to women with licensed healthcare providers. Crisis pregnancy centers like True Care prey upon people in their most vulnerable state. When they are concerned about their pregnancy and seeking help and resources, these centers push a religious agenda under the guise of providing healthcare. They are often staffed by unlicensed volunteers that are not required to provide accurate medical information, and they often provide deliberate misinformation about pregnancy. Yes?
Yes, please stay on the,
Oh, I'm on topic. This is exactly what this bill is doing. They are often staffed by unlicensed volunteers that are not required to provide accurate medical information, and they often provide deliberate misinformation about pregnancy, women's health, contraception, and yes, abortion. Additionally, they operate outside of HIPAA laws and have been known to violate patient privacy by sharing their information and in some cases notifying law enforcement about people seeking pregnancy information. In my view, these centers are dangerous and should absolutely be held accountable for the misinformation they spread while masquerading as healthcare providers. At the very least, they should be required to display prominently that they are not licensed healthcare providers and should not be allowed to advertise in the misleading way they do. But as far as I know, they are under no such threat of legislation in this state. So what is this bill actually aiming to achieve? It is clearly not looking out for pregnant people or patient safety. I would hope that this committee would exercise the same care and consideration in deliberating this bill as it did on HB 269 on naturopathic licensure. I do not protest these centers' rights to operate and exercise their free speech in advocating against abortion, but I do not think we should hamstring the government from regulating organizations that pretend to be healthcare providers when they are actively spreading medical misinformation with a religious agenda in mind. Please vote no on this bill.
thank you. Is there someone else on Zoom?
Yes, next is Emma Laura.
Thank you. Ms. Loring? Please state your name and whether you are for or against the bill, who you might be with, and you'll have 2 minutes. Thank you.
Thank you, Madam Vice Chair and honorable members of the committee. I'm Emma Laurent. I am insured and representing Wyoming United for Freedom. I oppose HB 273. I am testifying today on behalf of a woman who feels she cannot testify for herself due to unjust and potentially violent retribution at her workplace. When Jess, a 20-year-old UW student, found herself pregnant, she went to Heart, the Laramie Pregnancy Crisis Center. Due to the advertising, Jess entered Heart believing at the very minimum there would be a medical provider who could speak to her accurately about her medical status. She trusted this place of business. During the appointment, a volunteer rolled in a transvaginal ultrasound machine. It was required of Jess to not only undergo the ultrasound, but to administer it to herself because there was no licensed medical professional at the center. This committee claims it wants to help and protect Wyoming women. Tell me how Jess is protected that day at Heart. Tell me how this committee seems fit to create every possible barrier in the name of safety between women wanting to choose themselves and their own potential just for you to roll out the red carpet to protect a facility from having to deliver medically accurate information. You've given more thought to if a naturopath can remove a mole than if a non-medically trained volunteer can encourage a woman to carry a pregnancy to term. I know many of the committee members to personally be anti-abortion, but that is not a reason to exercise blatant government overreach. This bill is littered with biased misnomers like compassion and positive influence, where Jess and many women would argue they received none. You were not voted in to make medical decisions for the state. I implore you to remember that is not your role here today and vote no on HB 273. Thank you.
Thank you, Ms. Laurent. And the next one, I'm sorry. Okay, please state your name, who you might be with, whether you are for or against the bill. You'll have 2 minutes. Thank you.
Hello, thank you, Madam Chairman, and thank you, committee members, for hearing my testimony. My name is Katie Knutter, and I'm the Executive Director of Wellspring Health Access, the state's only procedural and medication abortion facility located in Casper, Wyoming. I'm speaking today in opposition to this bill. We have really grave concerns about HB 273. HB 273 represents an attempt to provide legitimacy and protection to these centers who serve no public health purpose and seek to spread misinformation to the public. The American College of Obstetricians and Gynecologists recognizes crisis pregnancy centers as a threat to public health. Crisis pregnancy centers do not provide healthcare and do not provide accurate information about pregnancy, women's health, or contraceptives to the public. These centers exist solely to dissuade people from seeking legitimate healthcare. They're staffed by volunteers who are unlicensed and not required to follow privacy laws such as HIPAA. And that means that people think that they're going to a legitimate medical facility that cannot share their private medical information, but they are not protected by those laws. CPCs do not provide accurate information to the public, and what's more, they use dishonest advertising to make it appear as if they are legitimate medical centers that do provide those services. They seek to use deliberately misleading names such as Choices or Woman's Choice. They often will open near legitimate healthcare providers in an attempt to confuse people to think that they will receive medical care at these centers. We've heard numerous stories over the years of people who go to these centers seeking ultrasounds for wanted pregnancies, in which case they are turned away because the center thinks that they may seek an abortion. So they go to these centers seeking healthcare and they're not provided it. We also have heard cases where crisis pregnancy centers have called out-of-state law enforcement on patients merely for seeking services at their centers. Okay.
Thank you very much.
Thank you.
Sorry.
I stand for questions.
Okay, thank you. Next on Zoom, please.
I believe the last one is Cindy Muller.
Ms. Mueller?
Good
Thank
morning.
you. Please state your name, who you're with, whether you are for or against the bill, and you'll have 2 minutes. Thank you.
Good morning. My name is Sydney Mahler. I'm here as a concerned citizen and also an advocate for women who has been working with victims and survivors of domestic violence, sexual assault, and stalking for over 15 years now. I'm opposing this bill, and I'm going to echo many of the same reasons that we've already heard. I have dealt with a number of survivors who felt unsafe participating in this hearing today, who have gone to one of these crisis pregnancy centers believing they were going to receive health care after a traumatic event, be that a rape without a marriage involved or external rape from a stranger. And they go to these clinics expecting to get health care. And instead, when they question what their options are, whether it's about Plan B or abortion services, they are shamed mercilessly. It is not comprehensive health care that these individuals are providing. They are also not being provided health care by medical professionals. Again, these are volunteers who are not required to have any particular training. They are also not protecting the rights of these survivors when they leave. We've had examples of cases in both Natrona and Albany County where survivors were called repeatedly after leaving the center because they had questioned about being able to receive abortion services or Plan B type services. And they were called repeatedly by the clinic after leaving, to the extent that we had to block phone numbers because they were being shamed for their decisions following a traumatic event. This only led to additional trauma for these survivors, and it diminished their bodily autonomy in their request and journey to get health care. And I think that is at the basis of all of what you've heard today. They are seeking and claiming to provide comprehensive health care, and they're using the brand of Crisis Pregnancy Center. And when someone goes in, they do not understand that they are not being provided accurate healthcare information, nor are they required to provide accurate healthcare information. And they're also unaware of the agendas that these centers push, which is blatantly against any pro-choice decisions. And for that reason, I would seek that you all vote no on House Bill 273. Thank you.
Thank you. Is there any other? Okay, well, public testimony on Zoom then will close. And are there any registered lobbyists? Are there any registered lobbyists? Okay, we will. Is there a second? second by Representative Heft. Okay, any amendments or discussion, committee? Representative Yin?
Madam Vice Chairman, thank you. I mean, I don't have anything crazy today to talk about, except that, yet another ideological bill about things that aren't going to happen, that we're going to fill our green books with. If it feels good, I guess that's what we're doing this session, so. Doesn't feel good to me to fill our green books full of stuff that isn't going to help anyone, because these things are never going to happen in Wyoming.
Thank you, Representative. Representative Clauston.
Thank you, Vice Chair Ottman. So just a discussion point, or we could maybe bring in this amendment. One of the speakers did talk about it, and it's something we dealt with last year, so if anybody else bring me up to speed on it, but page 11, line 8. We dealt with this last year, and I don't remember the findings. I felt like it ended up being found that it was a separation of powers issue, and we ended up deleting it, because I think this was in Bill 152 last year. So if anybody else remembers, if we can look back at that, we may have to delete this section, or at least we should discuss it.
Thank you. Is there any discussion on this? Representative Yin.
So, Madam Chairman, thank you. So I'm looking through the historical record of that bill. So that was 152 from 2023, actually, not 2025. And it did get removed in the Senate. So their particular clause in that bill was actually allowing one of the sponsors as a right of intervention. So this kind of widens it to the entire legislature. But I think the concern that they had in the Senate was that it was we're intervening in the judiciary with that part.
Representative, yes. I just forgot. Wassenberger, thank you.
Thank you,
I was gonna say
Representative Ottman. So what exactly was the original intent of bringing this bill up? I apologize, I had to run out real quick, but I mean, some of the testimonies I've heard is this kind of protecting people that have, that are protesting in favor of pro-life, and that group of people that's had like rocks thrown at them and things like that. When I read this, I was kind of, the understanding of it is we're protecting those certain types of pregnancy centers like Choose Life and things like that from discrimination of like the city councils, other local government officials. That's the original intent, correct? Okay.
Okay, yes, and I believe that was covered in the title. Yep, title lines. Okay, any other discussion? Okay, do I have, what's your pleasure? Oh, I guess we just vote. You ready to vote? It's moved and seconded. Okay, yes.
Madam Chairman, who moved and seconded the bill?
Okay.
What? You moved it.
Joel moved
Which
it.
amendment?
Oh,
No,
Representative.
Oh, I moved the bill, yes.
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 Representative Hoff.
I seconded. Oh, Representative Hoff seconded. Okay. Are we ready to vote?
I have an amendment.
Okay. Okay, Representative Clauston, your amendment?
Thank you, Vice Chair Ottman. So my amendment would be page 11, striking line 8 through 11. And again, this is something we've dealt with before. It's been taken out before. So my point being here is, knowing the past history here, let's avoid this discussion and this complication once again and just remove that part. The rest of the bill, I'm very in favor of. Thank you.
Okay, amendment has been moved and seconded. Any discussion? Representative Williams.
Thank you, Madam Vice Chair. I would just push back and encourage a no vote. I think that the previous court cases that deal with life are a prime example of why this is important to leave intact into the bill when it comes to what the intention was of the legislature. The ability to intervene, it has been, as Representative Yin spoke about, historically, it was taken out or removed out of some life bills in the past. And I think there's a strong lesson learned in that. And my hope is that the House would take note of how that played out in court. I personally feel that that this is important to leave in as a matter of right. So I would encourage a no vote on the amendment.
Thank you. Any other discussion on the amendment? Okay, you ready to vote? Okay, all in favor of Representative Clouston's amendment, please say aye. Aye. Okay, those opposed, same sign?
No.
No. Okay, amendment has failed. Okay, back, anything else? Committee, back on the bill. Are we ready to vote?
This is a roll call vote for House Bill 273. Representative Clouston,
Aye.
Representative Guggenmoss,
Aye.
Representative Hepp,
Aye.
Representative McCann,
Aye.
Representative Ottman,
Aye.
Representative Stivar,
Excused.
Representative Wasserberger,
Aye.
Representative Yen,
No.
Chairman Rodriguez Williams. Madam Chairman, that is 7 aye, 1 no, and 1 excused.
Thank you. Committee, the bill will go, and Chairman Rodriguez Williams, you will handle it on the floor. Thank you. Committee, seeing no further business, we are due on the floor in about 3 minutes. Thank you.